Bell's palsy.
Imagine waking up one morning. One of your eyes doesn't shut. When you're eating breakfast, you can't taste anything. When you're drinking, stuff is coming out the one side of your mouth. You go look in the mirror, and this is what you see. You have Bell's palsy. According to the Mayo Clinic staff, in 2008 through their online website, this occurs in 40,000 Americans every year. And as you can tell, it happened to me on February 18, 2004, when I was in 8th grade. According to the Mayo Clinic staff, Bell's palsy is paralysis of one side of your face due to a pinched or swollen nerve that interferes with your facial muscles. So in the case of myself, it affected my left side of the face. Since many of you have probably never heard of Bell's palsy or that it even existed, it is important to understand its symptoms, causes, diagnosis, and the treatment of it. First, we will discuss its symptoms. For myself, the day before, my face looked like this. My left eye twitched and watered uncontrollably, which is one of the symptoms. Then when I woke up, this is what my face looked like. My left eye wouldn't shut, so it wouldn't blink, it just remained open constantly like that. And then my smile was completely droopy, which is one of the main symptoms of Bell's palsy. According to Health ANZ in 2006, an online book, its other symptoms include pain in and around the ear, headaches, and an increase or decrease in the amount of tears and saliva that you produce. Now, since we know the symptoms, it is important to understand what causes these to occur. According to the Mayo Clinic staff, you have two branches of nerves, one that controls the right side of your face and one that controls the left side of your face. So for myself, my left side was infected. When these nerves become pinched, swollen, or inflamed, it interferes with those facial muscles and causes them not to work. So what causes the pinching or swelling of that nerve? It is due to viruses, according to Health ANZ. The most common is herpes simplex, but other ones include Lyme's disease, mono, shingles, and then in the case of myself, it is not actually known what caused my Bell's palsy. I wasn't sick at the time. I was tested for Lyme's disease, and that came back negative. However, my parents and I both wonder, when I had my braces adjusted the week prior to that, if that had anything to do with it. So now we know about its symptoms and causes, it's important to understand how they diagnose Bell's palsy. According to the Mayo Clinic staff, there is no specific test that they can do to determine if you have Bell's palsy. When you go to the doctor, they will basically just look at your face and have you do some motions with it, and then they'll determine if it's Bell's palsy or not. Sometimes when your face looks like this, it could also be due to a stroke. They may have you get an x-ray or a CAT scan done to look at and see how bad the pinching or swelling is around that nerve. So finally, I will tell you about the treatment of Bell's palsy. According to the Mayo Clinic staff, one can make a full recovery in 3 to 6 months. I was lucky enough to make a full recovery in a little bit over a month. And you can make a full recovery with or without treatment. It just depends on how severe your case is. According to my mom, Kathy Vansel, in an interview in 2009, she told me that I made a complete recovery with treatment, and so did my grandma, her mom, who had Bell's palsy. However, my grandpa, who got it at age 13 on my dad's side, did not make a complete recovery. And just a little side note, they say it is not hereditary, which is kind of coincidental that all three of us had it. So what do they use to treat Bell's palsy? According to Health ANZ, they will prescribe different kinds of medications. The first type of medication they may prescribe are corticosteroids. Corticosteroids are an anti-inflammatory such as prednisone. And I was given a course of prednisone after a lot of talking with my mom to the doctors. They didn't want to give it to me because of the side effects and how young I was, but my mom really pushed, she told me, so then they finally gave it to me. And also my grandma was given a course of steroids to help the inflammation decrease in her case. Another type of medication they may prescribe are antivirals, and this is just to stop the progression of the virus that may be causing the Bell's palsy to occur. Types of antivirals they may prescribe are acyclovars and valcyclovars. Another form of treatment is physical therapy. And physical therapy, one of the kinds is electrotherapy. And I had electrotherapy done as well. I went to the chiropractor every day for almost a month, and then it progressively got better throughout. And that is where they take a machine and it sends a nerve impulse throughout the entire nerve, going about each spot on that nerve to stimulate it, to get your muscles working again and get used to functioning. Other forms of physical therapy include exercising that side of the face and massaging it. According to the Mayo Clinic staff, a last resort for treatment would be surgery, and this would be to open up the bony depression where the nerve lies and decompress it. And then also, like I said, as you can see, my eye wouldn't shut, so that can be very detrimental to your vision in the long run because it's not being lubricated. So some people will wear goggles throughout that time that they have Bell's palsy. Luckily enough, I didn't have to wear goggles, but I had to tape my eyes shut every night, which other people have to do as well, and put in these thick gel drops to keep it lubricated. So today you have learned about the symptoms, causes, diagnosis, and treatment of Bell's palsy. So if you ever wake up one morning and your eye won't shut, or what you're eating you can't taste, and what you're drinking is coming out one side of your mouth, and you look in the mirror and your face looks as minded, you may have Bell's palsy.